We're thrilled to see that FDA has finally approved Pfizer vaccine for individuals 16 and over. There are still other vaccines that are under emergency use authorization for those 12 and older as well. We've been seeing some slight increases in vaccine orders from doctors' offices across the state, and we're encouraged by that, hoping to see some additional increases in individuals in Arizona getting vaccinated.
I know that we have spoken to people in the past, and they've been saying, many of them, that they needed this approval in order for them to go forward with getting a vaccination. Are you trying to use this in your messaging, if you will, to try to attract more people into getting vaccinated?
We know that these vaccines against COVID are safe and effective. The full approval of Pfizer vaccine um, further enhances that message for us. And so we're really trying to spread that message to the Arizona public to make sure they've got confidence in these vaccines.
And are you ready to meet the needs? Should we say you get tens of thousands of people who are interested all of a sudden in getting vaccinated?
Absolutely. We've got about over 1,000 vaccine providers in Arizona that can administer COVID-19 vaccine. That ranges from your local pharmacy to a doctor's
Okay, right
office
around
to
there.
community pop-up vaccination locations. There's ample vaccine availability for those providers to order. And we've got vaccine within 5 miles of about 95% of Arizonans in the state. So we are ready and able to vaccinate those who are interested in being vaccinated.
So, what do you see as the major roadblock now in the fact that so many vaccines are available and some people are still refusing to get vaccinated?
We want to make sure that people have an opportunity to get their questions answered. We know that the COVID-19 vaccines are safe and effective. They are also free for people, and they're the best thing that we have to prevent COVID-19 infection.
In terms of
So
getting
we're
more
really encouraging
info.
folks if they have questions to reach out to their healthcare provider or another
And that
trusted
needs some
healthcare
protection with that
entity in
irregular
order to
heart
talk through
rate.
their
And
specific and
yeah, just
individual
want to
questions and feel
confirm that.
confident that they can also get the safe and
Hmm.
effective vaccine.
What are some of the more common questions that you are receiving at the moment?
The questions really range. We've got a whole back series on our website as well to answer some of those common questions. We hear questions about whether vaccines can cause infertility. They cannot. We also have questions from people about whether they're effective. They are effective in preventing infections.
And what about storage of these vaccines? I know they have a shelf life. Are you deciding where the vaccines go depending on what type of vaccine it is? For example, we've heard that rural areas are less capable of providing the really cold conditions for some of the vaccines.
We've been fortunate throughout the period of this vaccine rollout that the FDA has updated some of the storage and handling requirements for vaccines. So, while, for instance, the Pfizer vaccine stays good longest in ultra cold storage, you can actually put that vaccine in a normal refrigerator that a doctor's office in a rural community might have and keep it for a couple of weeks to offer to your patients. And so, there really are much fewer barriers to administering and storing those vaccines, even in our rural communities.
And what about getting vaccinated in those rural communities? Any idea on how far people will have to drive in some cases to get the vaccination?
It really depends on where people live and how close they are to a retail pharmacy or a healthcare provider. We've got really good coverage for the vast majority of Arizonans across the state who can get a vaccine within 5 miles of their house. Some of our rural communities, though, certainly are farther away from healthcare services. And so we'd encourage them to visit azhealth.gov/find vaccine to identify the closest vaccination location to them. And we work in partnership with our local health departments and local providers to make sure that we can identify where there may be additional needs and provide services in those areas.
And what about testing? I've heard from some people that now testing is being charged in some cases by certain companies. Is the state providing free testing still?
There are several locations around the state where people can go to receive free testing, either offered through state supported contracts, local supported contractors, or many people have insurance that will cover the costs of testing, specimen collection, and testing if they've been exposed to a COVID-19 case or they're experiencing symptoms for COVID-19. So it's really important when you go to get tested that you're checking what the requirements are of that testing location to identify if those tests are going to be free or not.
All right, Jessica Rigler, thank you very much for joining us.
Thank you so much for your time.